briefing reporters on the latest on the corona outbreak. Let's listen in.
Members of it, some of them are here with us today. You see who's on it, who's not. Probably Hika's not on it. He's been focusing on the budget. Three basic areas that we have been operating on. The testing priorities, quarantine, and containment tracking. And we'll go through them quickly. On testing priorities, first priority for testing is people who have been in close contact. We define close contact as within 6 feet of a person who is known to be positive. Second, people who have traveled to a country with level 2 or 3 travel health notice from the CDC and is experiencing symptoms. Third is a person who's in quarantine and has developed symptoms while in quarantine. Fourth, a seriously ill individual who has not tested positive for other viruses. So when the person has gone into the hospital, they run the viral screen, doesn't test positive for any other viruses, then test for the coronavirus. Fifth, any other case in which, in the opinion of the healthcare professional and the local health department, they believe requires testing. So they would call up and consult with Department of Health on that one. Quarantine, there's 2 types of quarantine. We keep going back and forth between the word quarantine and isolation. Let's say they're basically synonyms, but isolation is the technical word. So it's really mandatory or directed versus what we call precautionary. Mandatory quarantine, anyone who tests positive, anyone who has been in direct contact with a person who's tested positive, anyone who's returned from a country CDC level 2 or 3, and is experiencing symptoms, any other person who their health professional and the local health department believes needs to be quarantined, and they'll speak to DOH to make that determination. That's mandatory quarantine. Precautionary quarantine, you return from a country with CDC level 2 or 3, but you are not symptomatic. Okay, that's precautionary quarantine. Proximate to a person who is positive. Proximate, not direct. Direct is within 6 feet. Proximate exposure is, I was in a car with a person, I was in the office with a person, etc. Third, any person who the local health provider and the local health department thinks should be quarantined, and again, they'll consult with New York State Department of Health on that. The last system that is operating is containment tracking. We're mapping all these cases, we're analyzing them, we're investigating them. Every time you get a positive, you run that case back to see who else could have been infected, and we are communicating that. The number of precautionary quarantines is at 4,000 statewide. You can see the list there. It's basically all across the state. Obviously heavier in New York City and in Westchester. 2,700 New York City, 1,000 Westchester, and then 115 Erie, 70 Nassau, Tompkins 15, Suffolk 15, Albany 11, Broome 4, and you can go right down the list. Schenectady 12, Warren 6. Mandatory quarantines, 4 statewide, New York City 9, Westchester 33, Erie 1, Nassau 1. In terms of new cases, yesterday we had 22 cases, today we have 33 cases, so it's gone up by 11. There is 1 new case in New York City, that is a case where a person is tested positive. It is connected to the Westchester case. 3 members of the Young Israel congregation connected to the Westchester case. All of the new cases are connected to the Westchester case. 2 friends, 2 people in Rockland County who worked at the bar mitzvah, and 3 patients, 3 people connected to the visit at the Lawrence Hospital. That brings, those are 11 new cases, 22 goes to 33. Just a general context question. The number will continue to go up. I've said every day the number will continue to go up. The number must continue to go up because it is mathematics. The more you test, the more positives you will find. And remember, we're predominantly testing people who have a higher probability because they're in the chain of contact with a person who has already tested positive. So people see the number go up, so the number's going up. The number has to go up. The number can't go down, and the number has to go up because we are testing people, because we want to find people who are testing positive. That's how you can find a person infected, quarantine them, and reduce the infection rate. That's what it's all about. Also, some of the news stories sum up what I have been saying. Say Cuomo urges calm. I'm not urging calm. I'm urging reality. I'm urging a factual response as opposed to an emotional response. I'm urging that people understand the information and not the hype. We have more people in this country dying from the flu than have dying from coronavirus. All the experts say 80% will self-resolve, 20% may get ill, may require hospitalization, and it's most problematic for senior citizens, people with immune-compromised situations, people with an underlying illness. The fact of our own experience, okay, I don't believe anyone, okay. The fact of our own experience, we have 33 cases. 5 of the 33 are hospitalized. 5 of the 33. That's about 15%. Verifies the about 20% may be hospitalized. Of the who have been hospitalized, they are improving, right? So those are the facts. What are we concerned about? Senior citizens in congregate facilities, people with compromised immune systems. Those are the populations most protect, which are also the populations that are most affected by the normal flu. That's why I go back to what I said to my brother. This is like a flu on steroids. You catch it this way, you target a population who's most vulnerable is the same, take the precautions. And there's flu season says to me, you should tell people don't shake hands. And don't. Why? Because that's how you communicate. Use the sanitizer. So it's the same precaution.
So we apologize for the sound problems we're having with that, but you have been listening to Governor Cuomo briefing the public on the state's response to the coronavirus. And the governor's saying 11 new cases, pushing the latest numbers at 23 testing positive.
Yeah, all of the new cases, the 11 new cases, all connected to the case in New Rochelle. Governor also saying that 4,000 people statewide are right now under a precautionary quarantine. A lot of people. Governor also talking about testing priorities and this, that, and the other thing. But the big news coming out of that there are a total of 33 cases in New York, 11 more since yesterday. We'll be right back.